right. It looks like there's actually no one else in our waiting room. And for the interest of time, I can go ahead and get us started. And this is being recorded, so we'll be able to share it out with any colleagues that weren't able to join, and it'll be on our website. So hello, everyone. Good afternoon, and thank you for joining us. I am Blair Thomas, and I am a senior program manager with the National Council for Mental Wellbeing. And this is being put on behalf of our National Training and Technical Assistance Center. Sometimes we just say the TA Center for CCBHCs. And just a little bit of background before I pass it over to Camden Coalition. So this year, we have been highlighting resources that we are offering to CCBHC grantees. We've had resources that are available to grantees since year one. We're currently in year 3. But we know sometimes they get lost in the emails or on the website. So this year we've been having these spotlight resource webinars where we're inviting our partners to share more about their product and how it can be utilized for you all. And then we are here to answer any questions around TA and how to access them for anyone that's a part of your grant. So that is what we are doing today. We have some past ones that are on our website. And like I said, this will be recorded and shared out and posted on our website too. And so we're really excited about this new partnership with Camden Coalition to have complex care certificates available for CCBHC grantees for free as a part of our TA. And so with that, I'm going to go ahead and pass it over to Carter Wilson to get us started in sharing more about this awesome opportunity. Carter?
Wonderful. Blair, thank you so much. And everyone, thank you so much for taking the time out of your day to come learn about the Complex Care Certificate. And thank you to just the National Council more broadly. You guys are a really close and appreciated partner in lots of different spaces, including here with the Complex Care Certificate for acquiring it on behalf of all of you. So I'll sort of first explain what the Complex Care Certificate is, and then we'll actually go through and look more deeply at it. We are talking today about a self-paced training for interdisciplinary care teams. So if your CCBHC has social workers, CHWs, nurses, psychiatrists, physicians, CHWs, all these groups working together in services of really complex individuals, this is for you, right? It ensures that all those providers have a shared understanding of what effective care looks like with this population. They sort of understand the barriers and how to overcome them and what their role is in overcoming them. That includes how do you build relationships and leverage those relationships with the clients or patients that you're serving in pursuit of their goals? How do you use their strengths to pursue their goals? And of course, how do you do so collaboratively, right? This is complex populations, almost by definition, touch lots of different organizations and different providers and different services. How do we make sure that they're all sort of swimming together in this work, both within your organization and within your community partnerships? And we're going to talk about how it can benefit you as a CCBHC internally, but as well as the ecosystems. Lee and Amanda Lynn are here to highlight those types of partnerships. So that's what we're going to be talking about today. Next slide has a slightly deeper overview of that, but let's back up. Hi, everyone. I'm Carter Wilson. I'm the director for the National Center of Complex Health and Social Needs, an initiative of the Camden Coalition of Healthcare Providers. Been here about 11 years, coming up on my 11th anniversary. I spent the first 6 years here building programs in our community of Camden, New Jersey, and helping to build those partnerships. And the last 6 working on the national stage and helping other communities do the same. But let me pass it to my coworker, Lee, to introduce herself.
Sure. Hi, everyone. My name is Lee Wilson Hall. I am the Director of Care Management and Clinical Redesign Initiatives at the Coalition. So that includes our care management, patient-facing teams, as well as our clinical redesign team that really works with both internal, external partners on pilots and demonstration work. So really excited to be here to highlight one of our primary partnerships with Oaks Integrated Care, local CCBHC. And we are huge fans of the CCBHC model. So very grateful to be here. And I will pass it to Amanda Lynn.
Thank you so much. I'm Amanda Lynn Salzman. I am an assistant vice president at Oaks. I'm a proud partner with the Camden Coalition. I oversee 3 of our CCBHCs in New Jersey, as well as a children's crisis response program. And Carter, I think it's going back to you.
Wonderful. Thanks, Lee and Amanda Lynn. So next, we're going to give just brief overviews of our organization, sort of what we do and how we collaborate. We'll then give an overview of the complex care certificate. I'll go a little bit deeper into what I just outlined and hear a little bit from Amanda Lynn, our CCBHC speaker on this webinar, to give a little insights into how they're using the certificate to advance not only their teams, but those of their partners. So, and then hope to bring it into discussion, right? Like we are all trying to figure out how to train and support our frontline providers because this is hard, challenging burnout work, and we are not supporting them enough in any spaces. So would love to just open that discussion about sort of what are the solutions you're finding and potentially how the complex care certificate could help enforce those strategies. But let's jump into the organization just real quickly. As we go through this, if you're interested, Blaine, you can go to the next slide. If you're interested in following along, so actually reviewing what we're talking about, you can just pull out your phones right now and scan that QR code. Ryan also, thank you, Ryan, drop the link into the chat if you want to do that on your computer. It won't take you to the actual content, it'll take you to the front page of it. We will be distributing over the next couple of weeks the code that gives you free access. We don't have that right now, but you can go and look at sort of what the courses are, get a feel for what it's like. So we'll leave that up. We can just move to the next slide then, and folks can follow the thing there. And Ryan, you might be able to drop the QR code in the chat as well. I don't know if that'll work. So the Camden Coalition. Camden Coalition is where me and Lee works. Amanda Lynn works at Oaks, the CCBHC. But we all serve the community of Camden and have, at least on the coalition side, for the past 20 years. And the Camden Coalition, we're all about how do we improve care delivery for individuals with complex health and social needs. And we use a pretty broad definition of that. It's really overlapping medical, behavioral, and social barriers that are driving poor outcomes. And really what's driving those poor outcomes is that the delivery system, the healthcare delivery system, the behavioral health delivery system, the social system is not set up to deliver effective care. It was not designed for these populations. And so we're trying to figure out how do we account for those siloed, inadequate services. So that's who we are. And we really do that 3 ways. The first is we do high-touch care coordination in community settings. So we use the data available to us and the partnerships that we've developed in order to find and engage really complex individuals and work with them anywhere between 30 and 90 days, and even beyond that. The second thing we do is we try to help bridge those siloed delivery systems. So how do we build partnerships and workflows across organizations and sectors that's really necessary to serve this population in the long term? And so Lee, those first 2 items, Lee oversees. It's called CMRI in our organization, but how do we serve those populations and build those partnerships necessary to enhance those services? And then the third thing we do is we help other organizations do those 2 things. So that's through our National Center for Complex Health and Social Needs. That's where I sit. And it's recognizing that lots of communities, yours included, are trying to find effective strategies for serving these populations. And there's a lot to learn, and there's a lot to share with others. And some of it isn't shareable, right? There's a secret sauce, there's a local flavor. And so on the National Center side, we try to figure out what's that secret sauce and how do you adapt it to local context. And that's what we try and do. So the Complex Care Certificate is a collaboration of both that local work and partnerships, but also that national arm where we sort of have a window into the operations of other communities, synthesizing that information and then sharing out. So that's who we are. That's the Camden Coalition. Amanda Lynn, I think you're up to talk about the great works that Oaks does.
All right, thank you so much. So just to give you a little background about Oaks, we are a private nonprofit organization in New Jersey, working with a variety of people. We were founded over 50 years ago by a small group of volunteers. And in those 50 years, we have grown quite a bit. We now have 2,400 employees, and we serve over 34,000 people a year. So a big difference from where we were before. We have 230 social service programs over 19 counties in New Jersey. So our programs work with individuals, families, and children who have a mental illness, who have an intellectual disability, who have substance use issues, who have SDOH needs, and it really try to bring the CCBHC model to that care that we're providing. So our services are ranging from ambulatory treatment, residence care, we have food pantries, We do all kinds of treatment, crisis screening, really a breadth of services that we're proud of. In 2017, we had the opportunity to become one of the first CCBHC demonstration sites. And we opened that up in our Mercer County, New Jersey location. And we had the opportunity to do that after working with the state on the planning grant. Since then, we have expanded into 3 other counties with 3 additional grants. And we've also been able to use the CCBHC model to leverage a partnership with a commercial insurer to do an integrated care approach to services. Our relationship with the Camden Coalition has been long-standing, and it becomes more robust through each of our partnerships. At the core of the shared projects that we have a goal of providing collaborative care to individuals with complex needs. An initiative that we're very closely working on is Pledge to Connect, but we'll talk about that a little bit later. So, Carter, back to you.
Wonderful. It actually might be to Lee to talk a little bit more about our local work that I gave a brief overview of.
Yes, thank you, Amanda Lynn and Carter. So, like Carter said, at the Camden Coalition, we really have a continuum of services, really at the core of which are our care management services on the ground, local work that's working directly with individuals with complex health and social needs. And then alongside that, we do a lot of work in partnership with local organizations, both community-based organizations, CCBHCs, and health systems, to really think about systems barriers and being able to test out and pilot new workflows. So before diving into the details of the complex care certificate, we just wanted to give you a very brief overview of what some of that work can look like, and in particular, what our partnership is with Oaks Integrated Care, which has been a multi-year project that we're really proud of around serving individuals with complex health and social needs, and in particular, individuals experiencing behavioral health needs who go to the emergency department. So Blair, if you go to the next slide. Thank you. So as Amanda Lynn mentioned, we call this project Pledge to Connect. This is really a cross-organizational collaboration focused on improving services for individuals who go to the emergency department for behavioral health needs. It is a partnership across the South Jersey region with our 4 major health systems in this region, Oaks Integrated Care and another CCBHC, Senda Integrated Health. And we are on now year 3 of being able to pilot really this embedded model where CCBHC navigators are really present and embedded within the emergency department teams to support those patients. So Amanda Lynn, I'm going to hand it over to you to give a few more details about the model before we give the data overview.
Thanks so much, Lee. Really want to focus on the relationships across all of these organizations and how fundamental they are to the success of this project. We took the chance to really challenge siloed services and have them come together, create a shared vision of how to best meet the needs of a person, but also while maintaining the integrity of each organization's goals. So, hospital systems have a lot of their own infrastructure that being able to partner with them required a true development of a relationship with them. So lots of levels of management and service providers participated in the development of this project. But it was really the frontline providers that informed how we were going to do it, what the needs of the individuals were, what the barriers were, and thoughts on how to collaborate about it. The most vital component of the relationships have been with the frontline workers doing this work. On a daily basis, all of my pledge staff have the opportunity to collaborate with ED doctors, nurses, social workers, community providers, and all truly work together to get the individual the needs that they have to transition back to the community from the emergency department. Lee?
Thanks, Amanda Lynn. And just building on that, I mean, one thing that we're really focused on at the Camden Coalition, and I know is shared among our partners, is around ecosystems of care. So in thinking about this project, one of the fundamental problems we were trying to solve was around fragmentation in behavioral health services, and just the feedback and data we had around the difficulty of navigating the behavioral health outpatient system from the point of someone seeking care to actually making and attending an appointment. So one thing we're really proud of with this program is, as you can see, is the rate of patients who not only engage with the Oaks and Ascenda navigators, but also the percentage of patients who, once they engage, get an appointment scheduled, which is much higher than the percentage of patients we're seeing who are able to navigate the system themselves and actually get to the point of scheduling an appointment. So this is now a model that we've built that really is built to address those silos of care that Amanda Lynn referenced, and that we're happy to provide more details around if anyone is interested, but is very much partnership based. And I just cannot speak highly enough about the work that the Oaks navigators have built and have done within the emergency departments. It is difficult to build new partnerships. It sounds so simple, and it is really difficult on the ground to really get down to those nitty-gritty details of figuring out how to embed within existing teams and change existing workflows. And I think that really speaks to the ethos of the complex care certificate in itself, of really the nitty-gritty of getting down to the day-to-day work. So with that, I believe I'll pass it back to Carter.
Wonderful. Blair, we can go to the next slide. So this is one example, a very good example of how CCBHCs and other organizations are building really meaningful partnerships in care delivery that we need to both learn from to sort of understand what's effective and inform to make sure that they are effective. Meaning this program, an ED to CCBHC workflow, is challenging. There's sort of three ways I think about how it's being challenging. The first is at the organizational level, sort of getting a hospital system and a CCBHC, both of which sort of just think differently and operate in different worlds. It's like the first challenge. The second is just programs, designing a program and like leveraging data and sort of just the workflow alignments is really challenging. But if you overcome those two, which are two huge challenges to do, you're then at the end of the day going to have a person in front of a patient or a client, whatever your word is. And the relationship that is built there is going to make or break the intervention. Those other parts matter. But if we don't get that part right, if we aren't actually able to go in front of someone who has a deserved mistrust of the sectors that we represent, and we're not able to build that relationship, doesn't matter how good your workflow is, doesn't matter if leadership's bought in. If you're not connected with that patient, you're not gonna be successful. And so we, the National Center, which is on the slide here, think about sort of all of those and sort of how do we overcome all those. But today we're talking about that last piece. How do you make sure that the provider is well equipped and has the knowledge, skills, and attitudes to sort of fulfill the promise that the program has made? So let's jump into that. So the next slide, we're going to talk about the complex care certificate. And Blair, you can just actually go 2 ahead. That's just the title slide. But I want to back you up sort of pre-certificate. We, in early 2020, like early, before COVID 2020, pulled together a working group of 15 folks from across the country. They were CHWs, nurses, physicians, academics, someone from a managed care plan, but mostly, I think 12 of the 15 had deep frontline experience, including 3 people with lived experience and a lived experience co-chair, patients. All got together and said, nurses need to be good nurses, social workers need to be good social workers, but people with complex health and social needs touch lots of people. How do we make sure that all those people are advancing the care plan, that have sort of the basic skills to build those relationships and leverage those relationships? So that was the challenge. It was saying, hey, is there a shared competency here? And if so, what are they? What do they look like? That group spent a year together defining the core competencies for frontline complex care providers. So discipline agnostic, setting agnostic, subpopulation agnostic. These are the basics that you need to have. So for example, you need to be able to assess the root cause of the individual's health needs. So really actually dig in and say, hey, what's understanding with the person that's right in front of me? Another is you need to recognize that you're temporary. You're not permanent. This is their life and their journey, and you're going to be a part of it for a short period. What role can you have in that short period that can help set them up for the rest of their journey? How can you help them develop those skills in order to overcome the inevitable barriers? Because we are not making their lives, hopefully we make their lives less complex, but we're not erasing that complexity. We're not erasing those barriers. Let's help make sure that we're delivering the skills that they can use long-term. And you need to contribute to collaborative decision-making. Amanda Lynn, you were just talking about your frontline providers negotiating with ED docs. That is not healthcare's process. I mean, my feeling and experience has been that physicians have been trained to be the captain of the ship. They're the quarterback. And they recognize that there are other disciplines and perspectives, but certainly when you're talking about someone that has significant behavioral or social challenges, those other perspectives need to be elevated in the decision-making. And so how do we train those frontline providers to sort of step into that role and really be that voice, that advocate for the parts that they know, because they have the deep relationship. So that's 3. There are 27 more that we say this is what providers need to have. That is the foundation for the certificate. So first, we pulled all those people together and said, hey, what does good care look like? What do you need to have? That's the competencies. And then we took those competencies and built curriculum anchored to. So that's what the certificate is. And that's what's on the next slide. It's the overview that's going to be I think it's too small to read, but yeah, it's way too small to read. So let me narrate to it, and Blair and team will disseminate afterwards. And you can also find this information in the link that's in the chat. Those 30 competencies became 9 online self-paced courses, where an individual on your team, using their individual login, logs on and at their pace and their timeline takes these 9 courses. Some of those courses I think are what you'd expect. Trauma-informed care, harm reduction, motivational interviewing. These are sort of common practice now. These courses, our versions of them, speak specifically to people with complex health and social needs being served in community settings, right? So we sort of narrow it to that world. But we also talk about what is power and oppression in this work. We're always navigating power dynamics. What is your role as a frontline provider? What power do you have? What power does the patient have? What power does the systems have? How do you navigate? We talk about care delivery. So what are the actions you're supposed to be doing? And what are the tactics you should be deploying? Talks about care planning, talk about collaboration and communication as part of teams and using a broad definition of teams. So not just your coworkers, but those in the community setting, as Lee and Amanda Lynn demonstrated. So it covers that full 30 competencies across 9 courses. And then it comes with 13 CEUs. That's probably worth highlighting for a range of disciplines. But then there's also these sort of downloadable team activities to help bring it into the care setting, because we do not believe that complex care is delivered as individuals. It's delivered as teams, and therefore education is best consumed as teams. And we don't think online self-paced education is the gold standard. We think you need dialogue. We think you need to bring it into your real world. And so we're bridging that divide. How do you be efficient with your care teams who have very demanding schedules, while also providing the resources to bring that learning into a collaborative space for ongoing dialogue and collaboration with your team? So that's the line we're trying to balance by offering it online self-paced and then these downloadable team activities that supervisors or managers can utilize. So I'm going to spend the next 5 slides just talking specifically about what I'm most proud of and what I think is the biggest impact of the certificate. And then we'll get to Amanda Lynn's sort of reflections on how Oaks is integrating it. But would love for you to be thinking about sort of what are the training challenges you have in your organization and how this might be able to fit or not fit. We'd also love that discussion. But I think one of the first things it does is this the first slide? Maybe it is. We'll just touch this one. One more up. There it is a lot of the training. Well, let's say first thing, social workers are trained to be good social workers. Physicians are trained to be good physicians. Nurses are trained to be good nurses. And so they're all coming with those frameworks. CHWs aren't really given one for the most part. Your CHWs may have gone through training, but this is sort of meant to apply to all of those. And what I love about it is all those folks nurses would go really medically complex populations, right? Social workers, maybe socially complex populations. This is the actual types of populations you would engage that have really diverse and overlapping needs. And we develop these sort of characters that you'll follow over the course of those 9 courses to help you really learn and understand the intricacies of someone's life and how it could impact their underlying health needs. So Jerome is a 72-year-old Vietnam War veteran, suffers from PTSD, lives in isolation. That's sort of one of him. And then Sandy, a 35-year-old woman involved in sex work, who is a great advocate and independent, but also can have some tension with the providers trying to serve her. And over the course of the 9 courses, you get deeper and deeper into Jerome and Sandy's stories, start to understand them deeper as individuals. That said, they are crafted. Those are crafted stories. It's really important that we learn from actual patients and actual providers. So if you go to the next slide, Blair, we do plenty of that. What we are very fortunate of is to have deep partnerships from folks across the country that are doing amazing work, and we're generous to share that. And so you will hear from patients, from real providers, and what I love is actually patients and providers talking to each other. Actually, what's on the screen here, it's a screenshot of a video. But if you watch the video, it's a man named Brian, who is a CHW, and Charlie, who is one of his patients, and them reflecting over their time together around what was impactful. And so what was the success they achieved together? It's those types of sort of windows into a relationship that I think really make this a powerful offering. The third one is strengths-based approach. I think a lot of times, certainly the medical providers, in my experience, have been trained, I'm the expert. I'm the expert, I deliver a service. You have a gap, I close it, right? That is not how complex care works, right? Here's an individual in front of you. Yes, they have gaps, but they also have strengths and they have goals. And so our job is, how do we build a relationship, leverage those strengths, help that client or patient pursue their goals? It's really strength. It's all about what do you bring to the table in your life and in your world that we can really leverage, and making sure that we're emphasizing that in the care plans, in our communications with the patients, and in our communications, written and otherwise, with one another. How do we really just start to view this population, talk about this population and what the work is differently, in a way that's much more positive and less deficit-based? So that's weaved in throughout. 4 is probably that frameworks, those frameworks, right? It's nurses have their own framework. Social workers have their own framework. CHWs haven't been given enough in terms of tools. But no matter what, they all need to collaborate and talk so that they have a shared understanding of the problem, a shared understanding of effective strategies to engage it, and a shared understanding of what success looks like. I would imagine, even if you were to talk to your team members, pilot this. Go to your team members in your next team meeting and ask everyone to think about what success looks like in direct patient care. My guess is you'll get a range of different answers, right? We actually aren't aligned around what we're trying to accomplish and what is accomplishable, if that's a word, with this population. So this shared framework sort of starts to give you that language and that common understanding. And then the last, I think before we jump into it, is that downloadable team activities thing, right? So online self-paced, that's really helpful in having an individual learner take the time they need in order to understand the content that's being shared. But ultimately, you want to apply it to your community, right? There is that local flavor, and that local flavor is with your patient population, it's with your partners, and it's with your team culture. And so how do you apply these learnings within your context? That, you can't skip it, you got to talk to it. And so we provide those resources to you to download it and facilitate those discussions, either by supervisors or managers or others on the team, to help bring that learning into the real world setting. So that's something we're really proud of. I don't have a slide here. Blair, you can go to the next one. I don't have a slide here, but another one that's really fun is there's 9 courses, but there's actually a 10th mini one. It's called the Systems Change Project. It's not required, all of this is optional, right? But the Systems Change Project is all recognizing that core to complex care is advocacy. The reason complex care exists is because the delivery system across medical, behavioral, and social is just poorly designed for this population. And so we are constantly working against that system, and we have to advocate. We have to advocate. We have to advocate. We have to advocate within our own programs and organizations. We have to advocate within our ecosystem of providers. And some of us need to be advocating at the state and federal levels. So advocacy sort of at all levels is what we are claiming core to being a frontline provider, which is a bold statement. It's saying you as a frontline provider have a job to advocate and change the system you are operating in. You need to be able to navigate that system, and you need to be working to change it. We love that statement. And we want to get teams thinking about how they can collectively be changing the system that they are operating in, and that is failing their patients and their clients. So that's something we're really proud of that isn't highlighted in these slides, but I think is worth calling out. So with that, I'm going to stop talking. Amanda Lynn, I hope you start talking, because I want to hear, if you go next slide, Blair, the one that has discussion on it. Wonderful. I would love it if you would kick off the discussion, and others, I hope you'll consider joining. I know it's intimidating to come off mute sometimes, but to discuss a little bit about training in CCBHC, sort of the skills you need, sort of how you're doing that and how you're incorporating the certificate. But Amanda Lynn?
Yeah, absolutely. I'm sure as many organizations on this call know that there are a ton of required trainings for our individual workers, right? There are trainings required by the state, there are trainings required by the governing bodies, there's trainings on how to fill out a vehicle log. I mean, from soup to nuts, you really need to do an intensive training with getting our employees up and running. With all of that, at the end of the day, things like this more, the higher level complex care and doing this kind of work sometimes ends up happening with shadowing. So we leave our current workers to kind of set the stage for our new employees. And I love this. I think there's a ton of value in being able to do that. But I also think that there are some risks, and sometimes having these like institutional ways of thinking passed down to a new generation of employees. So when the coalition came out with the complex care certificate, I was super excited that we were able to have a resource that our individuals could do in their own time. We didn't have to fill out like their orientation checklist, that this was something that was actually meaningful to the work that they did. Kind of in the spirit of the complex care certificate, we initiated it by having it having multiple levels of employees take it, just to see who really would benefit the most. They all do. But we think that the most value we've seen are in our nursing staff and in our community health workers, as Carter has been talking about. So really the people who do the most interfacing with our clients, but often have the least amount of training in how to do that in these really powerful, meaningful ways. So that's where we are. Now I'm coming up with my list of new people who are going to be taking it. It's very exciting.
So, folks, this is the time for us to answer your questions around the certificate and how it can be utilized, or just have discussion about training in CCBHC. So I'll just sort of kick it off. Amanda Lynn, the frontline role. I am not a frontline provider. I have never delivered care to patients. I have no business doing so. I do not have those skills, knowledge, or attitudes. But as an outsider, one that have worked closely with them, it's such a hard job. We're saying build a relationship with people that have a deserved mistrust of you, that have had really bad experiences and biased experiences, racist experiences with the systems that are meant to serve you. Now you're supposed to get them to trust you, get them to change their longstanding behavior to overcome all these massive, I mean, it's just such a hard job. And there's like, I'm just sort of wondering, with how are folks being trained? Is it just sort of on the job training? They're sort of going out and shadowing, which is important, but sort of, is that the standard by your assessment?
That is pretty much the standard that we have been doing, with being a CCBHC and expanding into other counties in New Jersey. We really are trying to find more creative ways to have this concept of integrated care embedded in training across the organization. This coming Friday, we are doing a all-level of management meeting to do some training around integrated care. Like, what is it? Why do we have it? How is it important? What does it actually look like in your specific role? So hopeful that that is going to be something that kind of sets the stage for more conversation around integrated care. But yeah, I think the theoretical pieces of doing this along with the practical ones aren't always so readily available. So yeah, that's what I
One thing just to add, both in terms of, as a social worker, my own experience in taking the complex care certificate and in getting to partner with Oaks and the team that is going through the complex care certificate is something that I think is very unique is the team-based aspect of it, that there's some of the content that overlaps with some of my social work education, some of which is new and I think unique and very, on the ground information. But it's been hugely beneficial to be able to discuss that information as a team and be able to do the group activities and debriefs. And I know Oaks is approaching it sort of as a team-based, activity as well. And I think we've gotten to see that even in our interactions with that team. And just there's a huge aspect of even building trust among your colleagues and getting to really sort of approach the information as an organization and as a department. So in case that resonates, and would love to hear, whether that does resonate with any of your training needs as well.
Folks, I'll give it a beat. This is the opportunity to engage. It's okay. If not, the thing I was reflecting on, Lee and Amanda Lynn, as you were talking was, CCBHCs, I think we're all really excited about the promise that they have and with the current reality that they bring. And one of the reasons is we addressed a funding problem, or at least partly, right? There's like new funding for like integrated care, and we all agree that that's great. There's certainly, we're working on the operations of that, right? That's a hard, as you were saying, Amanda Lynn, operationally, that's challenging to implement. But what this addresses the cultural integration, right? It's sort of that's the piece I think we all, in lots of programs, we sort of forget that piece. We're like, oh, do we have funding? Do we have a good program in place? Yep. But is the staff prepared to do? Like that one, I feel like we constantly shortchange. We like put attention in the other places and we just forget about them. But do others have that experience? I mean, some of you might be providers on the call and say, no, I got plenty of training ahead of time.
selfishly, I'd love to hear from CCBHC providers and how they do training. Maybe usurp some of your ideas. So any feedback people have on what the current experience is would be lovely.
We promise we're all very nice, and we're just curious to hear your experiences. I know being on Zoom sometimes it's like I don't want to unmute, but I know many of you reached out and were excited about this new training opportunity. So we're looking to just kind of learn and hear how training is going and how this might connect to what you all are looking for with your CCBHC. And you can put it in the chat too if you don't want to come off mute.
Or if it doesn't, we can take that feedback too.
Okay, Tina, are you a newer CCBHC? Are you a part of an organization that is interested in becoming a CCBHC?
So as far as I know, we have a grant for the CCBHC, and I was informed to attend. So I'm like, I'm not sure if I'm supposed to be here or what. I mean, the certificate, I heard that we have 9 courses to do. I've never done that, but currently I am a CCHW. So I'm like, okay, what I'm just confused. to be honest. I don't know if others are. But I've been part of the front line for a while. I mean, have quite experience with so many hospital and just like, okay, let's get this. What else do I need to know now? So that's where I'm at.
Tina, thank you for being brave. It is very brave to come on and speak to a group and to acknowledge, hey, I'm not really sure exactly what we're talking about here. Tina, I'd love to sort of understand a little bit of the confusion. When I understand is you're a CCHW is how you describe it, serving an organization that may or may not be becoming a CCBHC. That's sort of in question. But am I right that you're out there working either independently or as a team serving complex populations in the community? Or tell me a little bit about your role.
So I work for a treatment facility here in New Mexico called Four Corners Detox Recovery Center. As far as I know, we have a grant, and to do this, of course, we have to be in compliance as well. But this is something that we're, going to do, and I know that we're doing a little bit of it before, but it's kind of nice to be able to do a little more, as far as integrating with other, resources and just doing connection and just being there with our clients as well.
Absolutely. Tina, know that this was not built for CCBHC specifically. It's built for people like you and the teams that you're on that are just doing really great work for the folks in front of them, regardless of the financial status of the organization or the program, right? So that's really not relevant to the certificate. What's relevant here is that the National Council has generously sort of secured licenses so that CCBHCs can access for free. But if you're a CCBHC or not, if you're doing work like you're doing, we think this is valuable. It'll help you sort of have a structured approach to that care. The amazing care you're already delivering. It just provides a little bit of extra resources and tools to help improve.
Got it. Thank you.
Thanks, Tina.
Definitely, whether or not you're a CCBHC, the whole concept is that we are partnered with other providers in the community. So even if you aren't currently a CCBHC, you might have a relationship with one in your area. So that is a real driving force in the work that we do, is to develop relationships with substance use providers, with social service providers. So you're probably part of the CCBHC, whether it's formally or not.
Ben, thank you for contributing via chat. I'm seeing that now.
And if we truly have no other questions, then I know, let me actually share the last slide. Camden has provided their contact information. So shortly we'll send out a notification to those of you who attended and just generally to our CCBHC network when this resource will be available. If you ever have questions how to access the certificate, you can reach out to the support email listed here. Also, you can just reach out to the TA Center and we will provide access or connect you to how to provide, how you can get access to these resources. And I want to thank Carter, Amanda Lynn, Lee, and everyone for attending this session. We appreciate you so much. We believe this is going to be a great, this is a great resource for our clinics. And so we're excited to offer it to those of you who are interested. So please be on the lookout for more communication when this is available, and it'll have all the details about how to access and all of that. So with that, we will end a little bit early, give you all a little bit time back in your day. And thank you for joining us. Have a good afternoon. We'll see you at our next TA event. Bye all.
Thanks all.
Bye-bye.